of patients. Can you explain what a closed head brain injury is?
Sure. A closed head brain injury typically means it's a non-penetrating injury. So it's an injury that where there's no skull fracture, but there's like a jolting or kind of a rapid kind of force movement that has the brain, here shaking inside of a skull. But a closed head injury means that there is no penetration of the skull into the brain and no skull fracture.
Okay. And what is an MTBI?
An MTBI is considered a mild traumatic brain injury. And as I mentioned before, mild doesn't mean the symptoms are mild. Mild is just in reference to being juxtaposed to moderate and severe, which mean more of a bleeding in the brain or more kind of organic neurologic findings. So MTBI is synonymous with concussion because a concussion actually, as part of the diagnostic criteria, has no findings on structural imaging, and that means CT and MRI.
And what is PCS or post-concussion symptoms?
So PCS is the name of the complex process that occurs when a patient has been struggling with concussion sequela over a long period of time. In fact, there are different kind of categories of post-concussion symptoms. If you have symptoms for more than 3 to 6 months, for more than that, you can be categorized as persistent post-concussion symptoms or persistent post-concussive symptoms. So what this is just a patient that has concussion symptoms past a certain amount of time, and in Terry's case, by the time I saw him, he was struggling with these concussion symptoms for almost a year and a half.
Okay. And so are these names closed head injury, MTBI, post-concussion syndrome? These are the symptoms that Terry has? So,
yeah, these are different, names of different diagnoses that he could have. He had an MTBI, which is a concussion, but then you can also have PCS because that comes like in a timeline after someone gets an MTBI. But yes, he was diagnosed with a concussion and MTBI, and then also with the sequela, which is PCS or persistent post-concussive symptoms.
Okay. What are the risk factors for harmful consequences from a concussion?
Risk factors. Okay, so I think what you're asking me are there certain things that a person can go through or have that could increase their chances of having more issues with concussions? Is that what you're asking?
Yes.
Okay, yeah. There are definitely risk factors. There is a study that was done by one of my colleagues, Michael McRae. It was one of these seminal studies that actually pointed out that there are several what we call risk factors that can lead to a more complicated recovery and a more complicated presentation of symptoms. In Terry's case specifically, he met several of them. One was he actually had a prior diagnosis of anxiety and depression. And so having a prior mental health history is one of the big risk factors for PCS and persistent post-concussion symptoms. Another one was migraine history. So if someone has a history of headaches or migraines prior, that is also a risk factor. And another one was some of the structural brain findings that he had as well. I think it was called normal pressure hydrocephaly. Those are also some risk factors for post-concussion symptoms.
in Terry's case, what do risk factors mean?
Well, in Terry's case and in other patients' cases, it means that puts them at a much higher likelihood to have this complicated presentation and this complicated recovery. You know, it's just harder for them to recover, and their symptoms can last longer and feel quite debilitating. So,
in your opinion, Terry has persistent post-concussion syndrome or symptoms, in your opinion, has he recovered, or will he ever recover?
Terry came to my clinic, about 2017, so a little under 6 years ago. And he worked so hard. He really, gave his best effort. And he did notice, and we noticed, some definite improvements. But talking to him now, knowing where he is now, it is still showing clearly that he's still struggling. And so, I mean, if I have a fault, it's that I am an eternal optimist, and I always, want to keep treating and keep working, because I know neuroplasticity is real. But I think we're getting to the point where he's 76, and I do worry that some of these issues may be long-standing, but I still have some hope.
Okay. Let's talk about your process at your clinic. You do a clinical interview. Can you explain why and what that means?
Sure. So before one of the very first times that I met with Terry, I sat down with him and we went over what we call a clinical interview. And that is information gathering. I'm trying to assess what happened to him. I want to know what his symptoms were like. I wanted to hear about the injury that occurred. And so it's a really good way to gather information and to get a really good history of the patient. I'll ask about psychiatric history. I'll ask about some prior medical history. I'll ask about some prior concussions as well. And so it allows me to assess what's going on and to then have a clinical diagnosis based on that clinical interview.
Okay. When you first met with Terry, I think it was August of 2017. Does that sound correct?
That sounds correct, yes.
So that was about a year and a half after the ski crash that is the subject of this case. And what was his diagnosis at the time when he came to your clinic?
Well, he already came with a concussion diagnosis, right? And it was my job at that point to confirm that. I felt that he did meet that criteria, but I also was able to list out a year and a half later, or 15 months later, what symptoms he was still struggling with. And for me, what's most important is if those symptoms were things that I thought that I could treat or that I could help him with.
Is self-reporting and clinical questionnaire, like in Terry's case, how normal is that in assessing neuropsychological issues in the medical community or the psychological community?
So, very common. In fact, most of the time, by the time a patient gets to me, they've already had diagnoses from several other clinicians, right? I mean, usually a neuropsychologist is not their first person they go to, okay? But, really, as a clinician, the best way to ascertain if someone has a concussion is to ask them questions. We have some different types of tests that we can do as well, like balance tests and vision tests that we can do with them, which are very easy to do and can be done, very quickly in a clinical setting. But yeah, for the most part, it's talking to them, talking about what symptoms they have, when these symptoms started, and really identifying kind of an inciting event or a cause for what happened and when these symptoms started to come about.
What sense do you have, or any evidence do you have, that Terry might have been malingering, exaggerating, or faking his symptoms?
None whatsoever. Terry showed up to every appointment on time. He gave his best effort. The treatment that we do is very, very intensive. So it required Terry to show up every morning on time, to give his best effort in every single therapy appointment. And we're looking at, in a given week that he was with us, 32 hours of therapy, all right? He was an ideal patient. I got to see him every day while he was here in treatment and got to follow up with him and connect with him. And there was no issue with any of our therapists that he was in any way malingering or faking this. In fact, it was almost the opposite. Terry is, a very, very intelligent man, and he didn't want to be injured. I mean, I think that was really clear. It was he's someone that doesn't want to be sick and was willing to do everything he possibly could to improve where he was at.
Thank you. What is your understanding about his concussion in this ski crash of February 26, 2016? Was the ski crash a cause or the cause of his concussion?
Objection, leading.
Okay, I'll rephrase. You're familiar with the ski crash of 2016 he was in February, right?
Correct.
What are I'm getting at your preliminary opinions at this point. What significant problems was Terry suffering from, in your opinion, from this ski crash of 2016?
Well, he was reporting a myriad of symptoms, including cognitive issues. So, he wasn't, he was fatigued. He wasn't thinking as clearly as he was before. He reported some issues with mood, personality changes, pain as well, headaches, and so on.
And how significant were these problems, in your opinion?
Well, I mean, according to Terry's report, these were quite significantly affecting his life. I mean, it was affecting his personal life, his family relationships, his friendships, his ability to, have self-confidence. He was further isolating. He just it affected him on so many levels, especially for someone that was used to loving life and enjoying life and traveling and all that. By the time he came to me, that was pretty much gone.
Okay. Oh, I think I was mistaken. Maybe you saw Terry first in May of 2017. How significant or